All right, we are here today with one of our patients. He found us about a week or two ago. You actually found us online on some YouTube videos. You did some pretty extensive research on chiropractic, and you tried chiropractors back when you're a professional athlete, a professional fighter, and you had some experience with using your body a lot, and you were having some some stiffness and neck pain, and you've had hip issues with the hip replacement. You've had some back issues too. And kind of take us through your story about what brought you here and your past experiences, and how you're feeling so far. He's been here. This is his third treatment today.
Yeah, well, about my past, I'm a former world-rated kickboxer. Started, doing the martial arts many years ago, like in the early 70s when I started doing Taekwondo. But I fought a lot on ESPN, kickboxing. I was rated 4th in the world, and I was a North Carolina light welterweight kickboxing champion up until my retirement. Just a lot of hard, different training I used to do, CrossFit stuff and triathlons and just beat your body up, and I been in a lot of pain. I've been to, the doctors, the chiropractors in the past, and with no results. Just didn't get anything. I just live with the pain. If you know about the martial art, we as karate guys, we use a lot of our mind just to to go through life and just move on with different issues and stuff like that. But just in the past years, I'm really a health buff when it comes down to foods and stuff, the way I eat. So, and as far as health, staying in shape and stuff, it all works together, working out and food. So,
and we did arm wrestle before this about 5 minutes ago, and I have to say I took him down.
Yeah, he did.
So now, I'm sure you can stake me.
No, but just in the past years, a lot of this stuff when you're doing your younger years, that's why I tell a lot of my students and stuff, they take care of your stuff while you're young, because you're going to get old and that stuff's going to come back to affect you. And but I did have an injury, a truck injury, that caused for me to have a hip replacement. You would think it'd be the karate which caused that, but it wasn't the karate. It was just an accident that happened. So I had a hip replacement, and the doctor told me that I was going to have the other one done probably, 15, 20 years or something. He said I was going to start having pain. So he was right. But so I just was doing a lot of research on a lot of, trying to get rid of this pain, this and that for, for years. But, so I, let's put it this way. I had the hip replacement, and it's been now right at 20 years I've had that hip replacement. Have no pain in the hip, but it's sometimes had a little discomfort or whatever, but there's no pain. And I had a lot of pain in my right hip, And October of last year, I had stem cell surgery on my right hip because it was having a lot of pain and everything in it. And the day I had the stem cell pain, the pain that I had in it just totally went away. But the stiffness was still there. Then I just after that I started having a little discomfort, and my back, which I've had this tightness in my back for 10 years at least. And when I do a lot of lifting, strenuous work, and I try to straighten up at nighttime when I come in, and I have to straighten my back. Oh, it hurts. It's so tight and tense, And my neck, on my right side of my neck, it's like I could just turn to just right there before I come here. And now, I'm able to go side to side, and there's no pain, and there's actually no tightness there whatsoever. It's just, I haven't been able to move like this. I'm just able to move. It just feels so good. But anyway, my research, how I got here, this is what, well, it's just amazing. I mean, I do everything I do about when I'm gonna do something, I want the best. I want the best because myself, when I was on the national circuit, I was one of the best in the world. There's no doubt, nobody had to tell me. I just knew I was because of the way I trained. I was very dedicated, and I used to beat the best in the world, and I trained with the best in the world. And so when I had my hip replacement, I saw out a doctor who was one of the best, and he done me great. I mean, the hip has been good. And the same way, about 2 weeks ago, I started doing some extensive research on chiropractic because I've been seeing an acquaintance of mine, Dr. Bo Hightower. I hope I can say that if it's okay. He's a guy that who does a lot of the UFC guy stuff because I'm into a lot of jiu-jitsu and martial arts stuff. I'm heavy into that, and so he does a lot of the chiropractic stuff for these athletes, and I don't know him personally, but I do know him. I've been around, I've seen him, I've met him and everything like that. And he's just amazing with the things that I've seen him do and whatever. And I research, and I was gonna go try to visit him, but
was there second choice?
no second choice. But I just said, well, I live here. There's got to be somebody around here. So I did my research for about 2 weeks, at least 2 weeks or 3 weeks or whatever. I just kept on reading reviews on different doctors and chiropractors and stuff like that. And so, and then I come across Dr. Gerdes, Jeffrey. And I was like, wow. I kept on eyes for like, I don't know, it was probably 3 or 4 days. I was looking at his different reviews and different videos for like years ago. He was doing stuff like that. I said, now this doctor knows what he's doing. I said, I'm gonna give him a chance. I'm gonna see what the deal is. And I went there, and I'll tell you, my first day, after my view, the first crack, I was like, oh my God, and it's just, after my first visit, it's just, excuse me, words just can't explain it. I've never felt this good in 10, 15 years. It's just, the pain just totally went away from my neck, and it's just my lower back, everything was just tightened. I mean, it's just it was just so loose. And and I'll tell y'all something. I turned 60 and in May of last year, and my first child turned 1. And he just, he loves me to death, and he's always in my arms. And it just feels so good to pick him up and don't have to struggle with pain. There is no pain now when I pick him up. It just, we walk around and it has just blown my mind, like I said, it's just words. I can't explain it how it is. It's just the comfort. I have never felt this relaxed in so many years, and I'm just unreal. And I noticed a couple of things that have happened, and that's, I've always been told for like the last 20 years that I have asthma or something like that. Well, I've been on like a little breathing thing called Brio, Advair, tons of stuff like that for like the last 10 years. I'm supposed to take a puff every day, depending on which brand I use, or 2 puffs a day, but, sometimes I don't, and I can feel my chest just get tight. I don't know if it's just my mind or whatever, but in the last week that I've come here, this is my 3rd time. I've not used my breathing thing. I've not took a puff, not once since then, and my breathing just feels so relaxed, and also, which is just kind of weird. Also, I just, I don't know what. It's just that I quit eating meat totally, which I don't eat meat, beef and pork. Hadn't eat that probably 30 years, beef and pork, but I just gave up chicken and fish. So now I'm on a total vegan diet. I don't know if it's my first time here. When I came here, my blood pressure was up, and it has been up for like the last month that I've been on this diet. But it's like after my first visit here, and I went back home, because the night before I come here, I took my blood pressure, and it was like, wow, I'd never seen it that high before, ever. And when I went back home, later on that night, I was just sitting there, you know, looking at my stuff on my iPad and everything. I said, let me check my blood pressure. And my blood pressure had gone down. I mean, it's like, when I say this, I know I had high blood pressure, and it went down, I'm talking 50 points on each end. It was just, I don't know if it's the food, just changed the food, but I just felt like the chiropractic is what helped it, because my body was just so relaxed. I mean, just so relaxed, and I just don't know what to say. It's just so hard for me to explain it. It's just hard to explain the relief from, you know, so many years of this discomfort and this pain, and I am just so relieved. It's just so relieved. It really has. It's just been amazing.
Incredible story.
It's
you know, and I think the thing I'm most impressed that you've told me about yourself is that you're 60 years old and you have a 1-year-old at home. So
yeah.
When you told me that, I was really floored. And, so we're going to go through today and demonstrate what we've been doing here as far as the treatment, what's a little bit different, and give you guys kind of an inside look at exactly how we do our care here in the office. Okay, so first thing we're going to do here is a quick range of motion test on the cervical spine and the lower back. Can you turn your head left and right for me, please? Good. So pretty good. It's already increasing. No real pain, no real stiffness. Just a little tight, but let's take a look. We'll look, and then from there we'll look down and up, and then we'll come up. Any of that hurt there?
Yeah, that's tight. Yeah,
real tight. Yeah, still a little locked up in the lower cervicals, and then the upper thoracics as well. Let's take a look. Can you lay face down here on the table, please? So, first thing we like to do is adjust and manipulate the upper thoracic spine. So, T1, T2, it's this area in the upper part of your back. When you turn your head, if it's locked and restricted, it can make you feel stiff and stop you from turning your head the whole direction. Good. Still a little tight on this left side here. Now we're going to go into the Y-strap technique. We're going to release the vertebrae in the spine in an axial direction. Can you lay on your back here, please, face up? We're going to kind of scoot down the table just a little bit further. Good. And we'll kind of lock yourself in there. And we're going to bring the chin up. Good. And we'll come back slowly. Good. So just like to do a few little pulls up, get a good stretch, a little decompression in the cervical spine, upper thoracic spine. Good. Here it comes, good. Good. pretty loud one there.
Yeah.
That feel all right?
Oh yeah. Mm-hmm.
Come up slowly, good.
Mm-hmm.
And now we'll scoot up just a little bit here on the table. Good. When's the last time you fought a professional fight?
Oh, actually, oh gosh, actually the last time I ever competed, I fought a point karate tournament was probably 2009.
Okay.
2009.
So just
yeah.
maintenance workouts now.
Yeah, just exactly.
It's really starting to loosen up. Now we're going to go into the upper thoracic. We're going to do an anterior chiropractic adjustment. And now we'll cross both arms. Great. There you go. Good. Big bear hug. Yeah.
Yeah.
All right, now let's see. Can you lay here on your side? Face me, please. And now we're going to go into his lumbar spine, adjust the lower lumbars, upper lumbars, and his sacroiliac joints. Bring this leg up here. Good. Shoulders back. There we go. Good. And we'll lay on the other side here. This leg's gonna come up. Good. You okay there?
Yeah, that's fine.
This is your hip. Yeah, I'll be real careful on this side. Yeah, but usually I can do it without even touching it. So it's gonna be a little stretch back. Good. Okay. Great. Now let's see. We'll lay face down again here. Now also, what we like to do here in conjunction with the chiropractic adjustments is focus on some of the tighter, more inflamed soft tissue as well, like trigger points, knots in the upper back and the lower back. Those can be a cause of pain as well. Did you get your power back yet?
Yes, sir. You know,
I saw in Texas there was like 12% of the state today without power. Did you see that?
no,
Yeah.
wow.
All right, so we just finished the treatment. Tell us how you're feeling now.
Feel more relaxed. Yeah, I mean, you know, but oh, a lot, gosh, a whole lot more range of motion there. Wow, look at here. Yeah,
Good.
better. Wow, that's really better. I'm glad I found you. That's right.
Well, we're glad we found you too.
Yeah. So, you know, I'm really looking forward to it. You know, like I said, I got my parents coming. You know, 82 and 89
Okay.
next week. So
Great. We
looking
look forward to
it.
talking with them also.
Yes, sir.
All right. Thank you so much.
Thank you.
All right. Take care.
I will. You too.